Located at Mbarara Ntungamo Kabale Highway, the hospital has undergone visible upgrades, blending its historic post-independent architecture with modern structures renovated by the UPDF Engineering Brigade. Originally established in the 1960s and commissioned in the 1971. The facility now serves a rapidly expanding population due to this structure. Hospital Administrator Ham Owatuhire praised the durability of the original structure but emphasized that the current space is no longer sufficient to meet the demand. Local leaders are now calling for expansion of the critical service areas, including the wards, theaters, laboratories, and the mortuary. Inside the hospital, the strain is most evident in the maternity ward, where high admission rates have exceeded the bed capacity. Health workers report that at peak times, some mothers are forced to sleep on the floor due to the overcrowding in the area. Senior Nursing Officer Tabitha Tasima says that the increase in the deliveries is partly due to improved health education and outreach, which has encouraged more women to seek care at the facility rather than relying on the traditional methods. The hospital currently handles over 700 deliveries each quarter and serves a catchment population exceeding 15,000 people. Outpatient visits have also surged, with more than 68,000 recorded in the previous quarter alone. Despite offering a wide range of services, including HIV testing and counseling, nutrition support, laboratory diagnosis, X-ray and dental, to mental health and neonatal care, officials say that staffing levels remain critically low. According to the district health authorities, staffing stands at 28% below the 38% recommended by the Ministry of Health. The situation is further complicated by the unstable electricity supply. The hospital relies on an aging backup generator locally known as Benz, which consumes up to 20 liters of fuel per hour, significantly increasing the operation costs at the area. Even with the challenges, Itojo General Hospital remains a vital healthcare hub for Ntungamo and the surrounding districts, supported by improved diagnostic services such as ultrasound, X-ray, as well as strengthened maternal and pediatric care. District leaders are now urging government to upgrade the facility to the referral hospital status, noting that it already receives patients from at least 5 health centers and handles a growing influx of the referrals. With demand growing to rise, the hospital stands at a critical point, modernized in structure but stretched in capacity, highlighting the urgent need for the increased staffing, expanded infrastructure, and high-level support. Now, moving on to our next story. Air population now a leading driver of the heart disease deaths. Health experts are raising an alarm over the growing impact of the air pollution on the heart health, warning that it is now a major driver of diseases and deaths linked to the cardiovascular disease worldwide. According to the World Heart Federation, air population is the largest environmental health risk globally, responsible for more than 7 million deaths each year, alarming a nearly quarter of all deaths linked to the cardiovascular disease and are attributed to poor air quality. Experts say that the danger goes far beyond the respiratory illnesses. Tiny, harmful particles in the populated air can enter the bloodstream, triggering inflammation and significantly increasing the risk of heart attacks, strokes, and other serious complications. Globally, cardiovascular diseases remain the leading cause of death, and worsening air quality is now playing a critical role in accelerating the burden, especially in low and middle-income countries where access to clean energy is still limited. Exposed to air, both outdoors and within households, continues to put millions of people at risk, particularly those relying in the biomass fuel for cooking and living in the urban areas where heavy traffic and industrialization emits. However, the health experts stress that this crisis is largely preventable. They highlight the need for cleaner transport systems, energy-efficient housing, and also sustainable power generation to reduce the population levels, and strengthening industrial regulations, improving waste management, and expanding access to clean fuels and technologies are also seen as key steps in protecting the public health. Public health advocates are now also calling for government and stakeholders to prioritize air quality as part of the broader strategies to fight the heart disease, alongside promoting health diets, encouraging physical activity, and improving access of health care. Without this urgent, the coordinated action, experts warn that air population could continue to drive millions or more preventable deaths in the year ahead. Now, moving on to our next story, and this is just from our neighbors here in Kenya. There are flaws in Kenya's AI-driven health reforms, and this raises concern costs for the poor people. Health reforms in Kenya are facing a growing criticism after an investigation revealed that an AI-driven system meant to improve the health care access is instead increasing costs of the poor people. The reforms introduced under President William Ruto were launched in October 2024 with the aim of replacing the country's old national insurance schemes and expanding healthcare coverage, especially to inform workers such as farmers, traders, and day laborers. At the center of the system is an AI-powered model used by the Social Health Authority to estimate how much individuals can afford to contribute to the health care. However, an investigation by Africa Unscored, working with the Lighthouse Reports and Guardian, found that the system is deeply flawed. The algorithm, based on the method known as proxy, means testing users indicators such as the housing type, the household items, and also the family size to estimate the income levels. But findings show it often overestimates the earning of the poor livelihoods while underestimating those of the wealthy. As a result, many low-income families are being charged healthcare contributions far beyond. This means that sometimes up to 10 to 20% of their income, while wealthier individuals may pay less than they should. Reports from communities in Nairobi indicate that some families are now forced to choose between paying for health care, food, or rent. In some cases, patients have reportedly been turned away from the hospital or denied treatment because they cannot meet the required contributions. Critics say that the system lacks transparency, leaving many citizens confused about how their payments are calculated. Health economics are also arguing that the model prioritizes accurately assessing wealthier individuals, even if results are overcharging the poor. Globally, similar systems have been promoted by the institutions like the World Bank, but studies show how often they produce the many significant errors when identifying who qualifies as poor, sometimes excluding the very people they are meant to support. And in Kenya, the rollout has sparked public frustration, with many questioning the fairness and the sustainability of the systems. Despite over the 20 million people being registered, only about 5 million are consistently paying their premiums, raising concerns about the program long-term viability. Health experts warned that while digital innovations has the potential to transport the healthcare, poorly designed system risks deepening inequality rather than reducing it. As pressure mounts, stakeholders are now calling for urgent review and also reform to ensure that healthcare remains accessible, affordable, and equitable for all the public. Now, moving on to our global story. Global leaders warn of the rising attacks on the healthcare in the conflict zones. Global health and humanitarian leaders are warning that the attacks on healthcare in war zones are worsening, not improving, despite the international commitments made a decade ago to protect the medical services during conflict. In a major statement marking the 10th anniversary of the UN Security Council resolution, Resolution 2286, the heads of the International Committee of the Red Cross, the World Health Organization, and MSF said that situation today is even worse than it was 10 years ago. The resolution was originally adopted to protect the hospitals, medical workers, ambulances, and patients in the armed conflicts. However, humanitarian agencies say that these protections are increasingly being violated, with hospitals damaged and destroyed and medical staff coming under attack in multiple conflict zones. According to a joint statement, healthcare facilities are now being reduced to rubble, ambulances obstructed, and doctors, nurses, and patients killed or injured while seeking or providing care. They warn that when health systems are attacked, it signals a breakdown of the basic rules of war. The leaders stressed that under international humanitarian laws, all parties in conflict are required not only to respect medical neutrality, but also to ensure others comply with it. They called on states to use all available influence to enforce these protections. They also highlighted existing global frameworks, including WHO's reporting systems to attack on the healthcare, which they say must be strengthened to improve the accountability and also the prevention. The statement urges the government to take action, including integrating healthcare protection into the military operations, strengthening national laws, and providing funding for the protection measures, and ensuring transparent investigations into attacks on the medical facilities. They further called for consistent global reporting on the violations to help evidence and drive accountability for the perpetrators. Despite international laws made to safeguard the medical care in war, the statement warns that continued attacks reflect not a failure of the legal frameworks, but a failure of the political will. Their leaders conclude with a strong appeal to the world governments that healthcare must never be treated as a target in war, and urgent political action is needed highly to stop the continued loss of lives in the conflict zone. That's the message from the leaders, the UN leader and the leader for Red Cross, and also the leader for MSF. To our dear viewers, those are our news for today, and I would like to thank you for tuning in. We are going to take a short break and then come back with an expert discussion where you are going to learn something, and it will help you make better health decisions and how you can move your life better with a healthy life.
A CT, also commonly known as a CAT scan, the best way to describe it is it's a rotating X-ray machine. So an X-ray will take one picture, a CT will take a bunch of pictures while it rotates around you. You'll see your body in a full 3D plane on the images. A CT will be used for anything with the vascular or GI, so your heart system or like your bowels and stuff. I would say about 80% of our studies that we do, we use IV contrast. There are some exams we have where we have you drink contrast. The oral contrast will highlight anything within the GI, the belly system, and then the IV contrast will highlight stuff within the vascular system. Once a patient has checked into the registration, the technologist would come and get them, put them in a prep bay. We'd go through a screening form, so we may take a blood pressure, some vitals, then we would start an IV if we needed to. We would bring you back into the room and have you lay down on the table, make sure you're as comfortable as you can be. For most exams, we do allow you to wear your own clothes. For patients who are wearing an underwire bra, we may ask you to slip that off because that metal can create a little bit of artifact on our images. CT exams, typically you're on the table for about 5 minutes. Actively scanning for less than that, most of that is just the prep and the setup. We'll send our images off to a radiologist. Radiologist will look at it and develop a report. The report will get sent both to your ordering doctor and to your MyChart so you can take a look at it as well.
Brings a new beginning and a new day. We bring you the news that matters when it matters. From international headlines to the stories shaping our communities at home.
Because where is my ocean? I'm entitled to that ocean.
With expert analysis, in-depth conversations, and deep dives into the issues behind the headlines. We don't just tell you the news, we break it down. Start your